Today we need to talk about a serious subject, but in some ways it was the favorite topic of discussion in most junior high cafeterias, at least when I was in junior high, way back in the age. Anyway, nausea and vomiting. It can be a serious issue with those undergoing cancer treatment, especially things like chemotherapy, where a great deal of effort is used in trying to control the sense of nausea and therefore prevent vomiting. Many antiemetics are used during this time to help prevent the nausea and the vomiting that go along with the treatment. So we're going to talk a little bit about that today. And when we think about nausea and vomiting in cancer treatment, we need to remember some of the causes then that lead to nausea and vomiting as the patient is being treated. Obviously, chemotherapy, depending on what type of medication is being used, what type of chemicals are being used, can create either immediate nausea and vomiting or delayed nausea and vomiting, sometimes up to as long as 24 hours after the treatment's been received. So being aware of what type of medications and what type of chemo is being used, it will have either an immediate effect or a delayed effect. And that's important to know so that you can get the right antiemetics administered to help at least minimize, if not prevent that. Radiation treatment also has been known to cause nausea and vomiting in cancer patients who are receiving that treatment. Other things, though, to be aware of, not directly related to the cancer treatment itself, that can cause nausea and vomiting are such things as malignant tumors. A malignant tumor that has been associated with the GI tract can cause nausea and vomiting. Also, electrolyte imbalances can cause nausea and vomiting, and the discouraging thing there is if the electrolytes are out of balance and it leads to vomiting, then because of all the loss of fluids, it actually exacerbates the situation and continues the electrolyte imbalance and worsens it. And then finally, certain kinds of infection can also lead to nausea and vomiting. Most of these things associated with the GI tract. Now we want to talk about different types of nausea and vomiting, not just things that are directly related to the medicine being administered, the type of treatment being administered, or some sort of problem with the person's health. We want to talk about, just briefly, anticipatory nausea and vomiting. This is more, at least starts in the mind. It's a psychological factor. If someone associates nausea and vomiting with a particular environment, a particular set of practices, a particular smell, because of the fact that they've associated it that way in the past, they're much more likely to do it again. So, cancer patient comes in for chemotherapy, and they have known from their past treatments that the medicine makes them feel nauseous and they throw up. Just being in the same room, being administered the same treatment, can lead to anticipatory nausea and vomiting. This has made me sick in the past. I guess I'll just get sick now, even before the chemicals have started to flow. And this is a serious issue that needs to be addressed, obviously, with talking to the patient and trying to help them deal with those anticipatory thoughts that, let's not get the cart before the horse. If you're going to be sick, let's actually have a reason here. And basically, that's an issue to be aware of, that certain smells, environments, and certainly things that the patient associates with nausea and vomiting can lead to that feeling and that activity without there even being a real physical cause. They're anticipating it so much ahead of time because of their past experience. Then finally, refractory nausea and vomiting, here meaning uncontrolled. Basically, it's gotten to the point where even antiemetics won't help it. And there are some chemotherapies that lead to that kind of vomiting, and it's really dangerous because if there's uncontrolled vomiting, it can lead to a serious amount of dehydration. And so being aware of the patient's reaction to certain chemicals and realizing, getting from them how long did you have the vomiting, and that sort of thing can help get on the right treatment to minimize this and to try to associate proper antiemetics so that the person is kept comfortable, not spending a great deal of time feeling nauseous or throwing up, and certainly not getting to this point where it's uncontrollable and even antiemetics won't help, so that basically the person gets utterly dehydrated and has to be hospitalized. Anyway, that's a brief overview of nausea and vomiting as it relates to cancer treatment. We looked at traditional cancer treatments that lead to that. We talked about some things that aren't directly related to the cancer treatment that can also be causes of nausea and vomiting, and you need to be able to rule those out in determining what is causing the patient to feel nauseous or to emit. Is it just the treatment, or could there be something else in play? And then we talked about the real importance of dealing with anticipatory and feelings of nausea and vomiting, and then the dangers, and try to avoid the refractory form.